Okay. Hello, my name is Jill Riley. I'll be your nurse today. Nice to meet you. I'm going to go ahead and wash my hands this morning. Okay. I'm going to go ahead and get my hands wet first, and then I'm going to add some soap to them.
Okay.
And I'm going to rub in circular motion for 20 seconds.
I like that.
And I'm going to go about an inch above my wrists.
Okay.
And I'm going to clean under my nails, and if you have any rings, you want to get clearly clean well underneath it. It's better not to wear jewelry, but it is my wedding ring. So I'm going to rinse off the soap, not shake my hands, and I'm going to use a towel, one clean towel on each hand.
Why don't you shake your hands?
Well, I don't want to splatter any water or germs anywhere.
Oh, that makes sense.
That's the trash can right down there. Trash. And then after this, I'm going to go ahead and put on my PPE. And for today, all I'm going to put on are gloves.
Okay.
So, my hands are a little bit wet, but we're going to go for it. So today, how are you feeling?
A little dizzy, but
Okay.
that's it.
Okay, well, we're going to take your blood pressure, try to find out what's going on. First, I'm going to go ahead and check your name. I looked at your chart. Can I please see your wristband? Could you give me your name, please?
Reagan Riley,
And your date of birth, please?
May 12th, 2009.
2009. Okay. All right. So this is the perfect height. We're going to go ahead and have the bed in a semi-Fowler's position. And I'm going to go ahead and lower the headrest, or the side rail, so that I can have access to her arm. And any clothes that were down, I would lift up so I could have access to her arm. We're going to go ahead and use her left arm. And then I'm going to palpate for her brachial artery. So,
Does it matter if my legs are crossed or not?
well, actually it does. So if you would kindly uncross your legs for me,
Oh, okay.
please. But we hadn't gotten to that. We were going to. But first I was looking for your brachial
Okay,
artery,
sorry.
which I have found. So I'm going to go ahead and take my cuff. And it's marked on here, one for the left and one for the right. So I'm going to take the left arm and go ahead and put that right where the brachial artery is. We're going to do it snugly, but not too tight, okay? Make sure none of the apparatus is coiled. And then I'm going to use my stethoscope to go ahead and hear. First I'm going to put it in, and I'm going to inflate the cuff to here until I hear her pulse. And then I'm going to let it deflate it completely. And then I'm going to do it again to take her blood pressure, and I'm going to go 30 above where I heard her pulse. Okay, so I heard her pulse right at about 110, so adding 30 to that, I'll go to 140. That's gonna be my systolic number. Okay, I got 112/70 112 is her systolic number, and then 70 is her diastolic number. I'm going to go ahead and completely let out all the air out of the cuff and let her sit. If we were going to do the orthostatic hypotension to determine that, we would have her lying in the semifallopian position here, and then we'd have her wait 3 to 10 minutes with the cuff completely deflated. And then, so I'm going to go ahead and raise this up just for safety because we have to wait so long. But I am going to leave the cuff on. And then after that, we would go ahead and sit her up, and we'd put her to the side of the bed with the bed lowered. And we would wait, we would do her blood pressure, and then we would wait 1 to 3 minutes. And then we would go ahead and have her stand up and wait 2 to 3 minutes. And then we would do her blood pressure. The bed would be completely to the ground. For any reason of her feeling dizzy, we would immediately put her back into bed and lie her back down. So again, we do the 3 different blood pressure times. 1 lying down, 1 sitting up, and 1 standing up, all to determine her orthostatic, if she has orthostatic hypertension. So any more questions, you can find me on YouTube. I just had one more thing for clarity's sake. I wanted to go ahead and let everyone know that when you sit up, that is when you wait 1 to 3 minutes before you take your second blood pressure. And then you will be standing up and you'll wait 2 to 3 minutes, and that's to take your third blood pressure. So just wanted to clarify the order of the wait time. And yeah, so hope you guys learned something today. Thanks.